Hi, I'm Dr. Steve Grinstead, author of the book Freedom from Suffering, A Journey of Hope. Today I want to talk about the importance of flexibility and mobility. As I was looking through some of the latest research on outcomes for effective chronic pain management treatment, they all say similar things about using an integrated chronic pain management approach. But when I look at some of the better programs offer functional restoration, which means they start getting people more active physically. That was a really important part of my own journey. I've been living with my own chronic pain for a long time now, over 30 years. I've been working professionally with other people now almost 30 years. So it's really important to look at this piece of the puzzle. A lot of the patients I've worked with over the years have had a mistaken belief that since I can't exercise the way I used to, why bother? I must admit that this was also true for me early on. Coming from a very high active background of martial arts and construction and going to not being able to walk more than 100 feet at first was very, very challenging for me. I learned a lot, though, in my rehabilitation process about activity pacing and the appropriateness of flexibility and mobility. A few years ago, I was looking at that term. I was searching that key term, flexibility and mobility, and I came across Dr. Pete Egoscue in San Diego. Dr. Egoscue has a lot of information about functional restoration and about using non-pharmacological flexibility and mobility enhancing protocols to help people. I think people really need to be an active participant, including physically. Diet and nutrition are also an important part because if you're going to exercise, you've got to be fueling your body appropriately. I know how important it has been for me to use water. Hydrotherapy or getting in the water and doing mild exercises has been very beneficial for my low back pain. I can do things in the water, walk a lot longer, swim, than on dry land because gravity is not in the equation. I make it a point today to swim 3 to 4 times a week. This is a crucial part of my pain management. But before I swim, I need to make sure that I stretch good, that I get myself as flexible as possible. Do a lot of good stretching, get my mobility range going. And this is what I want to help other people develop. And this was a crucial part for me of achieving my own personal freedom from suffering. If you're watching this on YouTube, you can look below and see more information about flexibility and mobility and exercise. Or if you're seeing this on one of my blog pages, you'll have the information right here. So thank you for joining me today, and remember, freedom from suffering is a right, but it's also a responsibility. Thanks.